As an overview for the presentation, I would like to, within the 15 minutes, which is probably only 15 minutes now, touch upon a bit of the background on Israel, build it, some of the highlights of what we're doing in health promotion and health literacy in Israel, looking at a bit about policy, looking at action and practice, some capacity building and research, and a few recommendations that can be a basis for any kind of discussion we'd like to have. Firstly, Israel is a country of cultures. The culture was brought up this morning. That is what Israel is really all about. If we look at the breakdown, you can see that about 20% of the people who live in Israel are Arab-speaking. Another 20% are native Russian speakers. And the other 60%, basically many of them will be coming from other countries. And a growing number will be Israeli-speaking from birth. But it's not just the language, it's the different cultures that come together. And that, of course, presents a tremendous challenge for health services, for health literacy, for health promotion. Just a little bit of a profile of health in Israel. I'm not sure any of you have ever encountered any of the data, and it changes all the time. I think we're doing a pretty good job with life expectancy, ranks fourth in the world. Universal health care coverage is something that I think we're pretty proud of. As of 1995, there's universal health coverage for all citizens, all people living in Israel. That includes primary, secondary, and tertiary care. Risk factors, what we're seeing in the rest of the Western world, or westernizing world, 20.9, 20.3, and 20.9. Smokers very slowly, extremely slowly leveling off. Over 60% overweight or obese, 20 to 30% regularly engaged in physical activity. But of course, if you break it down to cultures, we'll be seeing the difference. We'll be seeing that there'll be Arab women who are much less physically active, Arab men much more smoking more. Religious men and women much less physically active, etc. Average number of physician about 6 to 8 per capita. We have growing rates of chronic disease, which all of you are very familiar with. Although we have a very low GDP for healthcare, we are having increasing out-of-pocket expenses for health, and we're worried about creating disparities. So these are definitely challenges we're trying to do. This slide is only here just to inform you that as we enter the OECD last year, more and more of our health indicators are being compared to other OECD countries, and here you can see that Israel ranks 11th in smoking in OECD, and a number of our measures have been compared. Regarding literacy, for whenever we know that it contributes to health literacy, we know literacy is not health literacy, but we're often asked about it. So I thought it might be important if you know something about literacy in our countries, and Israel ranks about 67 with a literacy rate of 97% that was measured by the UNDP. It ranks about 17 in the world among 192 countries for digital communication, which is really getting much more prevalent regularly. So just to go into a little bit of what has been done, I will start with a few policy landmarks, just because I think one of the things that we can say about what's being done in health literacy is that we're looking for the best opportunities, and we're looking for ways in which, in an integral way, health literacy can be brought to the fold. We're not yet seeing a national initiative for health literacy and policy for that, but we are seeing developmental goals on health literacy in the 2020 goals and objectives. A national strategic plan for reducing health disparities that has health literacy within it. A very new directive for the Ministry of Health. The Director General has given an unfunded mandate on cultural and holistic accessibility of the health system. As you can see, we're talking about cultural mediators, and so on and so forth. And this is going to be a very big challenge for us to meet this. The whole system is supposed to be culturally and linguistically accessible by February 2013. So I'd just like to mention very briefly a few examples, just really some tastes and sounds of something's done in community primary care, in hospitals, and even in the media. Most of the experience that I have come from private health services. As was mentioned, we're the second largest non-governmental health organization in the world. Israel, just a small country, 7.8 million people, in a country about the size of New Jersey. But it is the second largest organization, second to Kaiser, and our colleagues from Kaiser are, of course, number one. And it's for historical reasons, the way in which the health system infrastructure was designed in Israel. So we have 35,000 workers, over 1,300 primary care clinics, 14 hospitals distributed around the country. As you can see, many other services, and this is a good basis for some of the action plans and some of the action pieces that we put together. We have a national plan for initiating and for reducing disparities. And one of the aspects that we've developed and have been able to sustain is partnerships for health promotion within this very strong health literacy piece for new immigrants. We were fortunate to be able to partner with the Ministry of Health for being able to train, to locate, train, employ cross-cultural liaisons, mediators in primary health care. So I think our Italian colleague mentioned it this morning. It's a program that we call Before Shalom. It includes an integral part of the team is a cultural liaison serving the Ethiopian population. This is where we first tested this model. We partner with NGOs to do this. We have telephone translation as well at Amahart. We have a special community diabetes program, and we also train and coach health staff on cultural competence skills. And this was published last year in the Global Health Promotion. If you want to see the data and want to see the article itself. After the first 5 years, we initiated this in the late 90s. The first 5 years we did a 5-year evaluation. It was actually a clinic-controlled study, and we saw the major findings where the program was effective in improving physician-patient relations, when it was talking about new immigrants, improving availability and accessibility of medical services, improving the ability to navigate the health system, and we did not see any increase in expenditure on services that were incurred. And I think that is a very important point because it hasn't come up that much in the discussion so far, but it probably will, and I think it's on all of our minds and all of the policymakers' minds. And it's been the longest sustained program that we've had. It's been working for 14 years, the longest community program for cultural mediation that's been implemented in Israel to date. And we're trying to use that as a model for other programs. Another action point that I wanted to mention was the issue of diabetes and chronic illness. Just quoting Renders, we see that no one specific intervention, if used alone, leads to improvements in management of chronic diseases. So we know that a complex problem will only be solved with complexity of solutions. And we have put into our quality indicators, our national quality indicators program in the community, we've added disease management for diabetes, CHF, hyperlipidemia, hypertension, and rehospitalizations as quality indicators. And looking back, we're looking at what interventions, including working on health literacy needs, we need to do. So looking at an overview of strategies for diabetes, we've been working very strongly on health literacy tools, in-service training for doctors and nurses. We've been doing this consistently for the past 10 years, and over 3,000 doctors and nurses every year are trained for another aspect of treating health literacy, treating diabetes. We're running lifestyle and self-management workshops that are culturally appropriate and been developed along with groups of community citizens and people from the community in an empowerment framework in order that the self-management workshops will be more adapted to their needs. And we tailor programs for special populations. We published the data about 12-year follow-up from this program last year, and frankly, we'd like to see the data. You can see it in the article. Just giving you an idea of how we're expanding it every year. From 2006, it started earlier, but from 2006 we've been following it with data, looking at the scope of the workshops and the healthy lifestyle and self-care, and the extent to which the importance of being able to access, understand, use information for the health, which is a strong health literacy piece, has been contributing to it from year to year. If we look at the effectiveness of outcome measures, looking at HbA1c measures for diabetes balance, then we see that we're seeing that it compares before and after, and those who haven't participated in a control model, we're seeing great improvements in the measures, and we measure this 6 years after. So when we put the health literacy component into it, we want to be able to gauge it and see what it's contributing. Going from the community to moving into the hospital area, I'd like to mention that we have two main, I would say, health literacy initiatives that have been part of and been basically embraced by other very large initiatives. Most of you probably know about health promoting hospitals, and we have Professor Pelican here, who I think is the initiators and has been the lead of this initiative for, is it 20 years, Alice now? And I'm very happy to say that Israel recently joined the network of health promoting hospitals, within which we're able to talk and create the dialogue on health literacy. Once we call it a framework, then we can speak about health literacy. And this happened in tandem with the Joint Commission of International giving accreditation to colleague hospitals and kind of recognizing excellence in patient education. And there is also a health literacy piece. So we're looking at special initiatives within which that we can have health literacy initiatives. And I think we're looking to improve and we're looking to promote health literacy. Our experience is that when we work with other initiatives together, it might sound opportunistic, but it becomes more integrative. We're able to take it further. So just in summary, we do have tremendous challenges for bridging health literacy gaps in Israel. We have new and very preliminary policy initiatives for health literacy. It's a systems approach. It's complex. We're looking at the complexity of health literacy action. And research is in its early stages, but we're going to definitely take that forward. So if we would just like to make our recommendations and our contribution to the discussion, we think we would like to look more at strategy for health literacy of all policies, kind of prevent the silo effect, collaborate in research, build out experience from colleagues and partners, which we have done up until now, and I hope after today we will do more, and have international initiatives for professional training and policy building. And I want to thank you all. I wish you all a happy New Year. Whenever you start your New Year, using I have to rush back is to do that for our holiday. So thank you very much once again, and I wish you the rest of have a very, very